Good afternoon. Thanks for coming to my presentation on leiomyosarcoma, treating the whole family. My name is Elizabeth Nekoloff, and I come from Cummings Graduate Institute for Behavioral Health Studies. In 2020, at the height of the pandemic, when the world was dealing with COVID, my best friend actually thought she had COVID and went to the hospital. A few short weeks later, she was diagnosed with cancer. Not only was she diagnosed with cancer, she was diagnosed with a cancer that we had never heard of before. She was diagnosed with leiomyosarcoma. Leiomyosarcoma is a sarcoma cancer that affects the soft tissues. It accounts for 20% of individuals with sarcoma cancer. Although it accounts for 20%, soft tissue cancers only account for 1% of all cancers. For this reason, it makes the diagnosis and the treatment for leiomyosarcoma very challenging for not only the patient, but the patient's family. Things that are available to those with breast cancer or cervical cancer, such as a support group, can be difficult for families diagnosed with leiomyosarcoma. As family members and patients with leiomyosarcoma sit in support groups where people are very hopeful, it's a different experience for them as there is no one treatment that cures leiomyosarcoma. Leiomyosarcoma, the survival rate is 65% for soft tissue cancers. However, 40% of cases of leiomyosarcoma will develop metastatic disease after the initial cancer has been removed. I have recommended a clinical pathways that begins with the oncologist that would lead the oncologist to make a referral to connect the patient and the patient's family to a doctorate of behavioral health to assist the family through the process of this diagnosis. It is very important that not only is the patient clear with their primary care physician, it is imperative that family members also explain and divulge this information to their primary care physicians, as dealing with a person with cancer could lead to stress. It could also lead to physical health problems that needs to be discussed with the primary care physician. Cancer is a word that is known across the world. Leiomyosarcoma is not. Therefore, it calls for a different approach for not only the patient, but the patient's family. And it is imperative that an integrated care approach is utilized to help these families navigate the system. So therefore, I will be moving forward